So let's talk about cerebral palsy claims, or cerebral palsy in general. Cerebral palsy is an umbrella term which relates to brain damage which was sustained either before birth, shortly after birth, or in early childhood. It affects not only cognitive functioning. Now, cognitive functioning would be your understanding and your ability to communicate with people around you and interact with the environment, but also physical movement, your body parts and how they either function normally or don't function normally, and your ability to walk and pick up things, etc. When it comes to the brain and the types of injuries that you can sustain that cause cerebral palsy, there are a whole bunch. As a little baby or as a fetus in your mom's womb, you can sustain infection, you can sustain gradual damage due to what they call fetal growth restriction, due to placental malfunction, things like that. So when you get to labor, to being born, your brain has already sustained an injury. There are also injuries can be sustained due to lack of blood flow to the baby at a certain period, which affects the brain at a certain time, say between 24 and 34 weeks. And that's even a different kind of brain injury. And then I suppose the most contentious is when a mom gets into labor and the labor is not managed, or I should maybe not say not necessarily managed appropriately, but the child develops for one reason or another. The baby doesn't get enough blood flow and enough oxygen to the baby's brain during this high pressure moment, and then the baby gets born in an asphyxiated state. Asphyxiated means that there hasn't been enough oxygen to the brain. Now, some babies are born in this asphyxiated state, and the resuscitation that they receive immediately after birth can get them back to a normal or a normoxic state, so normal oxygenation. And they haven't been in a low oxygen state for long enough to damage their brains, and they get away with no injury at all, which is very lucky. Other babies are less fortunate. They've either had a sustained period of low oxygen to such an extent that their brains do suffer an injury. Other babies suffer a very sudden and complete cessation of oxygenation. So, for example, if the uterus tears, or the placenta tears away from the inside of the uterus and abruptly stops the blood flow, or there's some cord abnormality in the positioning of the baby, and then there's a sudden complete blockage of blood flow to the baby, and the baby can endure that for a very short period of time before a brain injury will occur. So in those instances, babies born in an asphyxiated state and will immediately start showing signs of brain injury, or a brain insult rather, such as fitting and not being able to latch onto the breast, to suck properly, and the tone of the baby isn't right, and the baby might start being stiff or very limp. Babies present in different ways. In any event, that's referred to as a neonatal encephalopathy, and the neonatal encephalopathy is described as the window to an intrapartum injury. So you cannot have had a birth injury, as I've just described, in that birth process, that will lead to a claim unless you show signs of that brain injury immediately after birth. in the form of a neonatal encephalopathy. Other instances or causes of cerebral palsy would be what we call a focal injury or a physical bash to the brain or to the head. But you also have instances such as, for example, meningitis, when the baby has an infection. That can be due to bacteria or to virus, and there's sometimes, in very limited instances, something that people can do to stop or to get to the virus or the bacteria before it affects the brain. But as a general rule, meningitis is hard. It's hard to avoid meningitis from damaging the brain. Then another one is bilirubin or jaundice, when the baby goes yellow. Now, jaundice has there are various scales on which jaundice can happen, and as a general rule, if you have raised levels of bilirubin in your blood, they can treat it with phototherapy. As those levels increase, you can do a total replacement transfusion where all of the blood in the baby is replaced, and that blood will be carrying bilirubin, which affects the brain. All of that blood gets taken out and it gets replaced with fresh blood that isn't infected with a high bilirubin count. And then if that happens in time, then the brain damage is avoided. But obviously, if not, then unfortunately the bilirubin does affect the brain tissue and causes brain injury. So which of those types of brain damage lead to claims? So I spoke about the neonatal encephalopathy. Now there are procedures and there are guidelines that guide the maternity staff as to how to monitor moms in labor and how regularly to do that, what to do, how to respond to the fetal heart rate, because the fetal heart rate is very sensitive to a low oxygen state. Now, you can obviously only treat things that you can see and that you can observe. If you're a midwife, you can't treat low oxygen or hypoxia if it happens before the mom arrives for labor. So the mom arrives and gets assessed, and then that tells the staff at what intervals to monitor the mom and how to monitor the mom. And there will be conditions that were apparent in the antenatal checkups that will also indicate whether the mom is at high risk or not at high risk. And there'll be other indicators like previous cesarean sections or complicated births or stillbirths even. So those are the sorts of indicators that tell the staff how to monitor the woman who is in labor. And if the guidelines are not followed, and for whatever reason the staff miss the hypoxic condition, the fetus is very susceptible to a change in oxygen status. So when the body is in low oxygen, there's a nerve response, a nervous response where the heart starts beating faster or slower. So in an effort to try and redistribute whatever oxygen is in the blood to the periphery and to the important parts like the brain and obviously the important organic tissue, the heart will respond. And as the baby becomes more and more stressed, so the heart will beat in different ways. And that's where the importance of CTG tracing comes in, and careful monitoring of the mom and the fetal heart rate, and realizing when it's time to do a cesarean section and when one must try and speed up delivery. If that low oxygen state leads to a baby that is born with low APGAR scores. They score the baby on what's the baby's color, is the baby breathing, what is the baby's heart rate, those sorts of things. So they give it a score, and that score is either low, which indicates the baby needs to be resuscitated and they need to try and give the baby oxygen, get the heart rate going again, get the baby breathing. So those sorts of things tell you how the baby's doing, and if the baby's APGAR stays low for a long time, then obviously that is an indicator that the baby might have suffered a brain injury. So a low APGAR often leads into the neonatal encephalopathy. So if you have a neonatal encephalopathy, the fitting, the poor condition of the baby, a baby who stays in hospital for a number of days and gets treated in the ICU, sometimes weeks even, is an indicator that the baby suffered low oxygen or was hypoxic during the birth process. Why is that so important? Well, it's an indicator that while the mom was in labor and being attended to by staff, there were things that could have been done differently, and certainly not in every case, but in some cases. Things could have been done differently to deliver the baby before that low oxygen period damaged the brain. Now there are other instances, like I mentioned, the placental abruption, when the placenta pulls away from the uterus, from the inside of the uterus. That is so sudden that the baby's brain gets injured very quickly. 10 minutes, 15 minutes can be enough to cause quite severe harm. But in a perpetual low oxygen state, during the contractions and the stresses that the baby endures when it's in the womb, that gradually affects the baby. And there is enough time in that sort of situation for the nursing staff to realize that the baby is under stress. They call it fetal distress, and to then call a doctor and say, listen, we've got this bad CTG tracing, or the heart rate doesn't sound right. Would you like to do something? Or we should do something. And then it's up to the medical staff as a team, the nurses and the doctor, to then arrange for a cesarean section or expedite things, turn the mom on her side. That can sometimes help because the baby may be lying on its umbilical cord, or it may be able to deal with the stresses of labor more easily. If the mom's on her side, that's called materno-fetal resuscitation. So yeah, there are things that can be done that can potentially change the outcome. So in an instance where a child has the neonatal encephalopathy, it's an indicator that something may have gone wrong. And it's those cases where one needs to investigate. Was my labor managed badly? And did that lead to my baby suffering a neonatal encephalopathy and ultimately suffering cerebral palsy? When it comes to, I described the bilirubin and the jaundiced baby. So some babies are more susceptible to sustaining jaundice and brain damage as a result of that, and there should be warning signs for the staff. Some babies must be kept for longer, a late preterm baby, for example. Preterm babies are always kept or should be kept for weight gain, but a late preterm baby sometimes can be discharged a little bit early, but the parents need to be warned that, listen, if the baby's skin color changes to yellow, please bring her back immediately. And then the staff must know that this is an at-risk baby, and they must monitor, and there must be referral to the hospital in time, that the hospital can put her under phototherapy, can potentially give a transfusion to avoid high levels of bilirubin. And it's those high levels of bilirubin that you can't reverse, and you can't reverse the brain damage. So there are numerous instances that can lead to cerebral palsy in a term baby or a near-term baby. I described the 24 to 34 weeks brain injury. That can sometimes affect premature babies. And we've had instances where substandard care has been the cause of what we call PVL, or premature white matter injury. So that will also lead to cerebral palsy. And if that happens to a baby, what one does is obtains the records and sees whether it was the birth process that might have led to it, or an infection perhaps, which are unavoidable, or whether the management of the baby as a premature baby was such that it might have caused this injury. Now sometimes when it comes to premature babies, they need ventilation, and there's certain ways of managing the ventilation, and there's regular what we call blood gases that must be checked, that can tell whether the baby's got too much carbon dioxide in its system, whether the oxygen levels are too high or too low. And that is a tell for the staff to do something differently, to increase the rate of ventilation, to decrease the rate of ventilation, to decrease pressures, to increase the oxygen levels, those sorts of things, to ensure that the premature baby's oxygen levels and blood flow through its body and through its brain is optimal to avoid injury. So it's certainly not the rule, it's more the exception of the premature baby who develops PVL or white matter injury, who will have a claim. But certainly we have several babies who were born prematurely who suffered injuries. In fact, we've got one or two who suffered injuries because in administering fluids and medication to the baby, a bubble got into the line, and an air bubble into the line can be fatal, but certainly can cause a baby to collapse and have a heart attack. And when that happens, well, there's no oxygen flowing through the body and no oxygen flowing to the brain. And in both of those instances, we had brain damage which was actionable, in which we're claiming from the hospital or the doctor or the people involved. So yeah, if you think that your baby's damage or that your child's damage was avoidable, even if it isn't in one of the categories that I've discussed, then you're welcome to give us a ring or send us an email, and we'll gladly look into the circumstances and advise you as far as we can.